Good morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before, during, and beyond bariatric surgery. So grab yourself a drink and a healthy snack because we have the man watching today, and he can see, especially if you're on the pre-op diet, he can see. We have Dr. Ortiz in the house. Hey.
Hey guys, Dr. Ortiz here. So nice to be here. Thanks for inviting me, Kayla. I believe that this is the second time, so we should do it more oftenly, right?
I agree too, Dr. Ortiz. And today, the first time you were at home, but today it looks like you're in the hospital. Are you finished surgery for the day?
No, actually, we still have some. I just finished our 129 robotic bariatric procedure.
Wait, can you say
So
robotic again?
robotic,
No, with the roll your R's, how you did it.
robotic,
Yeah, I
robotic.
can't do it. I love how you say it. It's so good.
So we just finished that one. It was a conversion sleeve to one anastomosis bypass plus hiatal cornea repair.
Ooh.
Very routine procedure, and we still have a couple of sleep procedures. So two more lovely patients.
Oh, nice. Well, we won't hold you up too long, but we do have some questions for you, Dr. Ortiz. Because people are always, joining the Facebook group or just finding out about us now. So for the people that are just brand new to EOC and kind of in their researching phases, can you just kind of share a little bit about your bariatric history, how long you've been a surgeon for, and what inspired you to become a bariatric surgeon?
There's people that just knows recently. Well, everybody knew us by. Well,
You're like, I'm kind of a big deal. The world knows about me.
Look, we've been doing, in my case, I've been doing bariatric surgery since 2012. And I was the first assistant of a surgeon back then, right? And like main surgeon, it's from 2013. So that's how many, like 12 years, 13 years in the field, right? So it's a long run already. Yeah, so at this moment we've done close to 29,000 bariatric procedures as main surgeon. Many times I don't want to say that number because it's very likely that nobody will believe that.
Right.
But so yeah, when I went my colleagues in international congress and they asked me how many surgeries I've done, and I tell them that number. The second question is, how old are you?
Right.
And I usually was like the youngest one. Not anymore. I'm 44, getting old.
Oh, come on.
But well, they starting to believe me. I'm starting to have here. Look, if you I notice that if you start having gray hair, people kind of believe you. So, but well,
Gray hair is in right now, Dr. Ortiz, but also number two, you know that there's a spa that can take care of that. Just your brother. Just
I
text him
heard.
for an appointment.
I heard about.
They do great. Dr. Ortiz, I only go to Encanto to do my hair because I can't find anyone else that gets my blonde as they do. So I will not let anyone else touch my hair but your guys' spa. So in saying that, Dr. Ortiz, you said that other surgeons that have been in the field longer than you, they don't believe that you've done that many surgeries. What would the average be for other surgeons, number-wise?
Well, I know surgeons that been in the field for the same time, and they have 2,000, 3,000 procedures.
Wow.
And don't get me wrong, that is a really good number. So that is, most of the surgeons around the world are kind of like in those numbers.
Correct me if I'm wrong, Dr. Ortiz.
In that frame of time, right?
Didn't you do in was it 2021? You did that many in 1 year?
Yeah, we did 2022.
Was it 2022? That's right. Mm.
Yeah, 2022. 2021, we did a fantastic number. 2022 was impressive. 2023 also. Right now it's getting, it's a little bit slower, but look, for example, I cannot complain. Today we did, we're gonna do 5 surgeries, so that's really good number. So
Right. And can I I'll chime in on that, and because I see this on social media a lot now, what, like, the things that are trending. And in 2020, 2021, 2022, bariatric surgery was everywhere on social media. Everyone wanted to do it. So, and then we hit that really big viral then too. So I think a lot of that kind of put us on the map, more kind of, a broader map for people like, wow, okay, Mexico is a thing. But you know what it is now that's trending, Dr. Ortiz? Plastic surgery. And I think it's because the boom from 2021, 2022, 2023, people have now, all those bariatric patients have lost their weight and now they want to come back for plastic. So that's now what's kind of like everyone's at that stage in their journey again. So, and luckily for us, we do both.
we do both. We have amazing reconstructive surgeons, right? Pasos, Rios, our Mendoza, our surgeons from the face, neck, and all the body. Their work is very impressive. They're like artists,
Very much so.
artists. Yeah. So those guys, they will have work for many years future. So
Yeah, definitely. So going back to bariatric surgery, so we all know that, bariatric surgery, people think gastric bypass, and I think the sleeve would be the most popular surgery, but there are so many more surgeries. So can you explain all the bariatric procedures that you offer?
yeah. We do. I'm going to tell you a list of the surgeries that we do. The number one procedure in all the world is a gastric sleeve surgery. Well, the most common performed. We also do the RNY bypass, the one anastomosis bypass, Sadie's procedure, intestinal transit bipartition, all the mix between them, conversions and revision surgeries. Dr. Galbao also help us with endoscopic sleeve or the RNY remodel endoscopically. So we do, and in all of surgeries that I mentioned, we also do it robotically.
Really?
Yeah. So, and people's going to ask, so why there's many surgeries? Why there's not only one? Exactly, because until this moment, we have not find the perfect surgery, right? There is no perfect surgery. There's many surgeries because there are many types of patients with different issues. So we have to check very well what is your condition, right? There's people who don't have diabetes and they have good genes, metabolic genes, that they don't have diabetes, they don't have high blood pressure, and they only want to lose weight because they want to feel better and they want to have better mobility and less pain in their joints, right? So, well, we can do a sleeve on them. There's people who has very, very bad genetics for diabetes, and we have to be more aggressive and do the bypass, intestinal transit bipartition, or the Sadie's procedure. There's people who their BMI is too high that you cannot bring them back to a normal or close to BMI with one procedure. It's possible, and you have to do it in 2 stages, right? You do first one, and then you do another one. And when people ask me, why don't you do only one? Well, my answer is always, look, your BMI is too high, is 60, over 60. So I ask them, how many years did it took you to be here or to get that BMI? It took you all your life to be in that position. So obviously it's not going to be like a magical procedure that wipes out all that past, right? So it's a process. And when people, in those cases, they will need several surgeries, right? 2 rounds of bariatrics, and then they will need plastic surgery. And well, you know more than me, they'll need 2, 3 rounds of that also, right? So yeah, there's no single best weight loss procedure, and that is why we have a list of options, right?
Right. And can you explain the difference? Because you said there's two different bypasses. What are the differences between the two?
Oh yeah. Before there's a one, the most popular one, the most that people can go and Google it. And every time that most of the patients they think in bariatric surgery, they go to their mind is pops the RNY bypass, right? RNY bypass is the most studied procedure in bariatric history, but we also right now have the one anastomosis bypass. The one anastomosis bypass is what it used to be called mini bypass. That name is no longer. Actually, we don't have to say that name anymore, mini bypass, because people they thought that it was a lesser procedure because the name mini,
Right.
but it was mini because minimal invasive. But we surgeons we say mini just to don't say the complete word because it's longer.
Right.
And yeah, and it was bad marketing because people thought it's a called mini, it's because it's less, and now it's not.
Okay.
So we changed it. In all the world, it was changed to one anastomosis bypass. So both bypass works practically the same with malabsorption. Both bypass is for people who has high BMI and metabolic people, diabetic people. The difference is if you have bad acid reflux, you should do the RNY better than the one anastomosis bypass. But if you have a problem with obesity and diabetes and reflux is not much of an issue, you should do the one anastomosis bypass, right? One anastomosis bypass is getting very, very popular in the States everywhere because it's if you check the complication rate in one anastomosis bypass is half the one compared to the RNY. But don't get me wrong, both are very, very low. Also, the one anastomosis bypass is half complications than the RNY. So if you are a patient with suffering with obesity and diabetes and acid reflux is not a main issue, you should get the one anastomosis bypass. But if you have both obesity, diabetes, and your reflux is terrible, the RNY bypass should be an option.
Right. So surgery wise, what's the difference? Because we know with the sleeve, there's like 70 to 80% of your stomach actually gets removed. So what's the difference between the RNY surgery wise and the one anastomosis?
Oh yeah, it's a huge difference. And
Is it?
yes, in the vertical sleeve gastrectomy, we are gonna cut and take out 80% of your stomach and leave a very thin and narrow stomach, like a banana shape. And that will cause you what we call restriction. So people are not gonna be able to eat as before. Why? Because there's not space there. Even if you try to eat like before, you will vomit because the food will not go down because there's no space. And also in the sleeve, in that part of the stomach that we take out, it goes all the hormones, the ghrelin hormone, the hormone that makes us desire food. So after the sleep, people they are not much craving for food. So that hunger sensation kind of goes away because that hormone that I mentioned you drops, your levels in the blood drops. You're not going to be thinking in food, and you're not going to be able to eat as before. That is why you're going to lose weight, and that is why also people love that procedure because they love to not feel all the time like anxious, trying to what I'm going to eat next and next. And that restriction keeps them away from being able to eat, even if they don't want to, even if they don't are not hungry, right? Uh, in the bypass, we leave a stomach that is 3 times smaller than the sleeve. You're gonna say, "Wow, so it is more restrictive." Well, no, because it's 3 times smaller than the sleeve, but the stomach empty faster. It's called a pouch. the stomach empty faster than the sleeve. So people, they don't have much restriction. Here we are gonna bypass like 9 feet of your intestines. We're gonna do like a shortcut.
Mhm.
So the first 9 feet of your intestines, the food will never go through those 9 feet of intestines. So that means that the food, it will go faster all the way down, down to the large intestine, to the stools, right?
Mhm.
So people will lose weight because of malabsorption. Yeah, they're gonna have a little bit of restriction, but never as the sleeve.
Wow. Okay. And then with the one anastomosis, is it just the amount of intestine that you're bypassing that's different?
And the RNY bypass, we do it in 2 steps. In the one anastomosis bypass, like the name says, we do it all at once in 1 step. So
Gotcha.
at the end, both are bypass, right? And practically they both work the same.
Gotcha. And so when a patient, is inquiring to have weight loss surgery with us, they are required to fill out a health questionnaire, and you review all of those, and you let the patient know what is the best. You approve them for whatever surgery is best for them. Is that correct?
That is correct.
Mhm.
I always all the patients, they have to fill a health questionnaire, and that health questionnaire is reviewed by the coordinators, make sure that everything's correct. Phil, and also Cindy Rios, who is our ASMBS nurse certified.
Mhm.
She also reviewed the all the health questionnaire, and after they do that, I review it myself. So I practically checked 100% of all the health questionnaires that we get. Yeah.
Right. So let's just say, for example, someone out there, they're like, I want the bypass or I want a Sadie's, let's just say. And then you read their health questionnaire and you're like, well, you know what? That's not the best procedure for you. I think you should have the sleeve. What happens then if they want, say, a more aggressive surgery, but you don't think that that's the way to go? What happens there?
No, they go to another. Nah. Look, people, obviously people, they want this or that, but
Mhm.
we have to check if they are eligible for that procedure or not.
Right.
If imagine some patient, they want the SATI procedure because they have a friend or a relative that had the SATI procedure and did amazing,
Hmm.
but person asking for the SATIs uh, has a low BMI, no diabetes. Obviously, I'm not gonna do the most aggressive procedure that we do, the SATIs, on that person, because that person is gonna have a lot of health issues. And instead of doing something good for them,
Yeah.
we will do something very, very bad for them. So yeah, I have to check well. If sometimes they want the RNY bypass because they heard that somebody had got the sleeve and they regain and they
Yeah.
don't want to regain, we tell them, look, you can regain with the sleeve, with the SATIs, with the bypass, and you're not for the RNY because your BMI is low, you're not diabetic.
Mhm.
This is for people with bigger issues, health issues, and this is too much for you. So you're good for the sleep or for the endoscopic sleep, or people sometimes they want the sleep
Mhm.
because they are scared of a bigger surgery,
Yeah.
but they need to lose a lot of weight and they are diabetic. They have a lot of health issues, and I tell them, look, it's for you, it's better if you do the SATIs or the bypass, or yeah.
Yeah.
So the end, we have to check very well what is the best procedure for each patient, right?
Yeah, exactly, you guys. So he knows what he's talking about. If Dr. Ortiz says, no, you know what, the sleeve is best for you, or hey, guess what, you're going to need a bit more of an aggressive surgery, you really definitely need to trust Dr. Ortiz because, yeah, what tends to happen is, yeah, my friend had this and it worked great for them, but guess what, you're not your friend. Everyone's starting point is different. Everyone's comorbidities are different. So I think um, a lot of the time people get a little bit like, oh, but I wanted this. It's not necessarily what you want, it's what's best for you. So you've always got that, that side covered. So just trust Dr. Ortiz and be extremely open and honest on that health questionnaire as well? Because I think sometimes what happens with the health questionnaire, sometimes people, they're worried that, oh, if I say I've got XYZ, I'm not going to get approved or something like that. But they need to be very forthcoming on those applications, don't they, Dr. Ortiz?
Oh, of course, you don't
Mm,
have to leave no information behind. Um, it's always better if you just come forward and we see it, and we can tell you if you need to do this or that. So, oh, for example, many times I see health questionnaires and I see that the patient has previous heart attacks or uh, catheterisms, and I don't accept them until they send me a cardio clearance, a recent echocardiogram, and it's not because I just want to make it impossible for them
mhm,
or hard on them. It's because it's better. Nobody wants problems. We don't want problems over here, and obviously everybody wants to go healthy and go back home, right?
mhm.
Mhm.
So yeah, that's really important. So don't leave anything off, you guys. So you were talking about you did a robotic surgery today. So can you tell us like what is kind of happening in the future of bariatrics right now? Anything exciting?
Yeah. Well, you know that um, in the medical field, everything is evolving
Mm,
constantly, right? And the machines, the technology always catch up, right? You have a phone right now. The next year, you have another phone, and
yeah,
technology goes like that, right?
it's fast.
So yeah, it's very fast right now. It's getting very fast. So I think that in the future, most of the procedures that we will do are going to be robotic right now.
Mhm,
Right now, if you ask me, Dr. Tispa, why don't we do all our procedures robotic? Well, the number one thing that keeps us not being able to do that is the price.
mhm,
That's it. If the price was same as laparoscopic, I would do all my surgeries robotic.
mm.
Uh, it's pretty cool. It's for me. It's kind of like playing PlayStation, something like that. Uh, It's really neat, state of the art. It's the best that you can give to the patient. The robot is super precise.
Mm,
The camera, the camera of the robot is way much better than the camera that we have in laparoscopy. The recovery of the patient is way much better
mm,
robotic than laparoscopic. You can do harder surgeries robotic than laparoscopic. It's a little bit more slower right now,
okay.
but it's gonna get better. And that's it. The only thing that we don't do it, the only reason that we don't do all our procedures robotic is just the price.
Right. And does
But
it
in the it will get more accessible
mhm.
for our patients.
Right. And is it costs more as a facility? Is it the tools cost more, the
Tool,
equipment,
the
the
tool, the,
gotcha.
yeah, the tool that the robot use are more expensive. Yeah.
How much does a robot go for nowadays, Dr. Ortiz?
Let's say if I want to buy the Da Vinci, it can be like 2.5 million, something like that.
Okay, no wonder why it's expensive. I wonder
You
why
want to
it
pitch
costs more.
in? You want to pitch in?
Yeah, set up a GoFundMe. I'll throw a 20 at it. Just take it from the top of my paycheck, Dr. Ortiz. Oh, that's funny. Okay, so you're a pioneer in the weight loss surgery world. I feel like you're always one step ahead of the rest. Now, can you explain to people out there what sets EOC apart from just say the bariatric facility down the road or the one in their hometown? There's a lot of things that EOC do different or do as a added bonus that a lot of places don't do. So can you run through some of the extras that EOC do?
Yeah, people are gonna ask why go here and not go to another place, uh, because I can tell you personally, here we have a team, and our team is very robust.
Mm,
It's in the States and in the Mexico side. It's huge. It's large, And most of the other companies, they don't have that, because in order for you to have that, well, you have to invest, right?
Mm.
Imagine it's like a business. You have to invest in your business to grow. And if you don't invest, you're never gonna grow. You're always gonna be like the small shop there in the corner. So people are gonna say, well, if the prices are very similar, why go here and why don't go over there? Okay, well, because since you arrive in San Diego, for example, in the airport, you're gonna get the drivers there and our full vans, right? Pick you up. Many companies, they don't have that. And then you're gonna be taken to a very good hotel, right? You've been to the Grand Hotel.
Hmm.
And yeah, you're gonna stay in. We practically own 2 floors in the hotel, and most of the companies they don't have that. So all after before and after surgery, all your neighbors in the hotel are gonna be AOC patients. So practically you're gonna be all the time with the same people at the hotel and the hospital. And then in the medical field, well, we have an endoscopy team,
Hmm.
and we do scopes before and after surgery, during the surgery, to all our patients. And practically nobody does that, not even in the United States.
Hmm.
Uh, an endoscopy before and after. And then we just bought the fibroscan. I don't know if you heard about that.
Yeah.
The liver test that we buy, that machine. There's only like 2 machines like that in Mexico, and we have one. And I don't know a U.S. doctor that owns a machine like that. So we can tell you how's your liver exactly in this moment,
Mm.
and it help us to take decisions to compare your liver before after. Uh, we can do your procedure robotic. In my case, I'm the only robotic bariatric surgeon that does currently robotic surgeries in town. And I'm the only proctor, professor of robotic surgery in town. And we do the ICG green test also. Not everybody likes to do that. And we give the pill, even the pill that you heard, the Prepitan pill that we give to our patients before.
I've been hearing great stuff about that.
So if you are counting the list that I'm telling you, it's 1, 2, 3, and everything is, you add up, and people, they don't want to do that because everything that I mentioned cost.
Yeah.
Everything has a price, and people, they don't want, like I told you, they don't want to invest on that.
Mm.
So, and then we have an arrangement with one of the most well-known bariatric surgeons in the bariatric field, with Dr. Almino Ramos,
Mhm.
ex-IFSO president. We have another arrangement with probably the best endoscopist bariatric in all the world, Dr. Galvao, who works with us also. Uh, what else? We have a very good dental group, right?
Mhm.
We have probably the best plastic post-bariatric team in all Mexico for sure.
Mhm.
Uh, so if you add up all the things that I mentioned, I already got lost in all the list that I
Right.
told you. And we have uh, better news, good news in the future, right? So most of the things that I mentioned. Oh, and we also do research. We constantly publish, and that is extremely difficult to
Mhm.
publish papers in the bariatric magazine. So but that is something very impressive to do. Most of our colleagues, they do not do it. Uh, also you have to invest on that.
Mhm.
So we invest a little bit here and a little bit there, and everything is for the best of our patients. At the end of the day, uh, it's good for us because all those little investments that we do here and there for the better of our patients, it gratified us
Mhm.
because we help more patients than than the other ones. So
Yeah, and it's definitely a lot of word of mouth too.
word of mouth, yeah. We have an amazing, in your case, well, we have an amazing team of what propaganda. We have a really good propaganda machine with you. Right?
Propaganda, is that what I am? Thanks.
We have like a cult. Our people.
Well, cast a little spell every now and then. No, I'm just kidding. But you briefly just kind of skated over you when you said, you're also a proctor/professor. A lot of people don't know that. So can you explain when you say that, can you explain like, what does that mean? And you're teaching surgery to up and coming surgeons. Is that right?
Yes. Well, a proctor, it's literally is a professor in robotics, right?
Mm-hmm.
There's only 4 proctors in all Mexico for bariatric robotics. There's other proctors for other things like urology, right? Traumatologists, things like, but in our field, bariatrics, there's only 4. And what does it means? That all surgeons, bariatric surgeons, that they want to be certified in robotics. Well, I have to certify them.
Nice.
So that's good for me because if I can help my colleagues also, that's good. You cannot do. It's not like you're a bariatric surgeon, and it's not like, oh, I'm gonna go and do tomorrow a robotic surgery. No, if you're not certified, you cannot do a robotic surgery. Even if you are a very talented bariatric surgeon, you have to be certified. And the person who certifies you, it's a proctor. That's right.
So it's kind of like getting your driver's license. You need to get your license to work that machine.
Yeah, exactly. You can be the best driver, but you need the license,
You
right?
get pulled over, you're in trouble.
There's a person that is gonna be with you driving, making sure that that you drive well. That's me. That's the proctor.
That makes sense. He's the driving instructor. But so
Driver, yeah, exactly.
pretty
Driver
much. I've been in the OR with you several times, and every time I'm there, I feel like there's people in there that you're kind of that kind of stand back and watch you. And these other are they called fellows? Is that what they're called? Correct me if I'm wrong.
Yeah, fellow surgeons, fellows.
And they come from all over the world. It's not just in Mexico, right? You have people coming all over just to basically learn off you.
Right now, we have people from Peru, from Ecuador, Costa Rica, a lot of places from Mexico. We had people before from the US. So there's people coming here and they stay with us. Some they stay 2 months, other ones they stay 1 year around. So we have fellows all the time. That is why when you go inside of the OR, you see a lot of people, right? It's full.
Yeah, they're just watching you, and they're learning from the best.
Yeah, they are there watching, filming, and some they get to scrub in, and help us out in the surgery, right?
Yeah, I think that's so cool, and I think a lot of people don't really know that about you. That people like these up and coming surgeons are coming from all over the world to watch you, and you're teaching them. It's pretty amazing, Dr. Ortiz.
And they come to see also Dr. Galbao, Dr. Nino, right?
Yeah, I mean, and like you're saying, so Dr. Almino.
I believe that also Lassos are plastic surgeon. He also sometimes have fellows with him.
Yeah, because Dr. Lazos was saying like there's not like a school that you can go to that teaches you how to perfect massive weight loss reconstruction. He's just kind of, perfected it. And now he's teaching other people his skills, which is amazing.
Yeah. Because usually when you hear about plastic surgeon, what do you think? That it's the surgeon that is going to do liposuction or breast implants or no, right? But Lassos, he does more than that. He's more than plastic. He's reconstructive post-bariatric surgeon, right?
Yeah, that's a whole special niche and field in its own. It's way more than just a regular mummy makeover.
Yeah, way much more complex.
Very much so. And you were saying Dr. Ramos and Dr. Galvo, they're not local to Mexico. Dr. Ramos is actually from Brazil, right?
Yeah, Dr. Ramos, he's those guys, they're like Mr. Worldwide.
Right.
Oh, like worldwide.
Uh-huh.
Yeah, Dr. Ramos, he's from Sao Paulo, Brazil, but he also do some work in Ecuador, here with us in Mexico. Dr. Galvao, he's now a U.S. citizen. He's Brazilian, but he's now U.S. citizen, and he lives in Orlando, and he works in Orlando here in Mexico with us, and he also do work in India, high volume center over there in India. So that's why I say that those guys are like Mr. Worldwide. They're all
Right.
around the world.
Yeah. So I love that. Yeah, definitely EOC is just not the run of the mill, in and out kind of surgery center. We are very, very in depth and experienced, which is really nice. So now that we've kind of got the background of all that stuff out the way, a lot of people have, some questions, and a lot of it is got a lot to do with like having a successful surgery and having success after weight loss surgery. So what advice or what are some key points you could give to patients that are, embarking on this journey for a successful recovery and great results?
Yeah, and when I told you the list of what we do differently, I forgot to mention Carmen, right?
Oh,
Dr.
yes.
Carmen
Uh-huh.
is our medical bariatric nutritionist.
Mm-hmm.
So remember that here at AOC, we also have our own brand of collagen, vitamins, protein, right? That you don't necessarily have to get it here. You can buy it online or go to any GNC store, and there's several
Mm-hmm.
brands.
Mm-hmm.
So but we have our own, and Dr. Carmen, she helps us a lot
Yeah.
with because she gives to all our patients a class, nutritional and alimentary class after surgery. So because not everything is the surgery, right?
Mm-hmm.
The surgery is only like 25 minutes, 45 minutes, 1 hour, depends on what surgery, and that's it. But to be successful and to maintain, to avoid regaining, you have to be very constant, and that's the difficult part, right?
Mm-hmm.
Because at the beginning, everybody's gonna lose. Everybody's gonna lose weight, because how are you not gonna be able to lose weight if we take out most of your stomach, or if we bypass most of your intestines? Obviously, that you're gonna lose weight. But the hard part is keeping it down,
Yep.
maintaining,
Mm-hmm.
avoid gaining weight. And for that, well, taking your vitamins, taking your protein, follow the diet, stay away from those bad habits that brought you here with us. That is the hard part. That is one of the main reasons that people get another surgery,
Mm-hmm.
because sometimes things happen in life, and uh, they got some issues of their own, and they regain weight, right? But yeah, not because you're gonna have weight loss surgery, it means that you're gonna be that the weight is gonna stay away,
Mm-hmm.
stay down forever. No. It
Yeah.
you can regain it all if you want to.
Yeah.
If you want.
Exactly. There's that honeymoon phase of weight loss surgery. The first, 4 months, 6 months, even up to a year, you can kind of coast by. But if you haven't changed your eating habits and like literally changed your lifestyle, you will regain. So it is really important to adopt those healthy habits really early on in your journey while the tool is working, at its best at that point, to really kind of also get your mind into gear at that point too.
That is why also we ask all our patients to do a pre-op diet.
Mm-hmm.
Depends on everybody, is different. Some people, we ask them 2 weeks, 4 weeks. And that is one of the reasons that we ask them for the pre-op diet, just to put them in the right mindset, right?
Yeah.
So for them to don't for it to don't be difficult in the post-op.
Right, exactly. And like you were saying about Dr. Carmen too, she she has a lot of videos here on if you're watching this on YouTube right now. We actually have a whole playlist of Dr. Carmen, and she goes through everything about the pre-op phases, the whole class that she does at the Welcome Center while you're there is up on the YouTube. It's up here. Yep, it's up there. She also has classes about seeds and fats and all that kind of thing in protein shakes. She shows you how to make, what goes, a lot of really good ingredients to go into a protein shake. She's done cooking shows. So it's that I don't actually know any other bariatric company that offers that kind of just free service. It's not like, oh, you pay extra to get this cooking class. Like, it's like it's all included.
Yeah, it's all included. Imagine instead of you watching a regular TV show, well, you can sit down there in your living room and watch a few videos of her, right?
Yep.
You said the classes that maybe you want to remember
Refresh.
something
Yeah.
mentioned, refresh
Mm-hmm.
what you already heard in her class,
Mm-hmm.
or see some cooking videos. So for you to cook good stuff, right? That it's healthy and
Yeah.
good flavor taste for you.
Yeah. And I'll tell you what, Dr. Ortiz, like I'm 7, 8 years post-op, but every time I'm in TJ, I always attend one of her meetings. And obviously, like I do get content for it there, but it's so good as a refresh, even on myself. Like every time I'm there, I will go and I'll refresh and I'm like, actually, you know what? Yes. Yes. And you live this lifestyle for so long, but it's always good to go back. And if you can, just rewatch that post-op class. You will learn something new or you'll take in more information. Now that you're further along down the line, things make more sense to you now. So go back, rewatch stuff, you guys. It really, really helps. Can I talk to you about, we were talking about the pill for the nausea. So how many people are doing that now? Is almost everybody opting to go that route?
Yeah, we published a paper of that pill. So we did a full research on the benefits of that pill, and it's like magic. It's like magic. People we offer, it's not mandatory because we have strong meds in the IV for pain, for nausea, for everything, right? It's not like we are gonna leave you there with nausea and dry heaving, and no. We strongly recommend everybody to take that pill. I believe that it costs like $50, something like that, $50, something like that. But it's a game changer. So you take it before surgery. I believe that like 80% of our patients are taking it. Like 80,
Wow.
yeah, eight,
That's
eight,
good.
7, 8 out of 10.
Yeah.
There's another like 2, 3 people that they go full brave mode
Yeah.
and they refuse to take it. But well, like I said, we have strong meds in the IV
Yeah.
for right. But I would strongly suggest that everybody take it as a game changer, and people who have taken it, they feel they notice a difference comparing with other surgeries they had before.
Right. That makes sense. Now, a hot topic on the Facebook page, I see this question every day, and it's like a lot of people weigh in daily, some people weigh in weekly, monthly, whatever it may be, but people stall when they're so used to seeing the scale going down each time they jump on it, and then sometimes they'll be like, "Oh, my weight loss has stalled for a month." Why do stalls happen, and are they normal?
Yes. Look, I always tell the patients that the best month from the weight loss standpoint is going to be the first one.
Mhm.
So they have to do better, and they have to do really, really good, because we give you the diet, the post-op diet, where it says very clear week 1, week 2, week 3, week 4, what you're able to eat, right? So I tell the patients, look, you have to be a really, really good patient since the beginning, because the first month is the best, is the better from the weight loss standpoint. After that, it gets kind of slow. It is kind of normal and accepted that people they lose average like 10 pounds a month.
Mhm.
So imagine if you go like that, it doesn't seem much, but if you go like that at the end of the year, depends on on the size of the patient.
Mm-hmm.
We are talking about 100 pounds, a little bit more.
Yeah.
So people don't get frustrated if you lose a lot of more than 10 pounds, more than 15 pounds by each month.
Mm-hmm.
People sometimes they lose in 1 month 4 pounds and they get a little bit frustrated. But no, don't be like that. I always suggest patients to record to your weight loss, to
Mm-hmm.
write down your weight loss once a week, because weighing yourself daily, that is not good. That means that you have a lot of anxiety, and anxiety will take you to a place that you don't want to be there. So you should weight yourself once a week. And I tell the patients, look, you should weight every Monday morning and write down. So that way you can track your weight loss, and you know if you're doing good or bad, or if you have to do better for the next week, right? But yeah, there will be weeks that you might not lose weight,
Yeah.
and more in women because
Mm-hmm.
of the cycle, right?
Yes.
Even that the hormones, they
Mm-hmm.
play a significant role there. So even it depends on your period cycle.
Mm-hmm.
Your menstrual cycle, it plays a role there. So yeah, you have to know your body.
It's
And
true.
but stalls, they do occur, and that doesn't mean that the surgery just stopped working. No, I always tell the patients, look, surgery, the work of the surgery will be done at the end, average 12 to 15 months, right?
Mm-hmm.
After that, don't expect that the surgery will still be working for you to lose more weight. So you have to do uh, your best since the beginning.
Yep.
If by any chance you did well in the first month, I tell them that month it's gone.
Mm.
You're not gonna recover it. So make sure that you take your vitamins, your protein, water, follow the diet, stay away from sweets, stay away from snacking, stay
Mm-hmm.
away from alcohol. Because if you don't do good in the first month, like I said, you're not gonna recover that month in the second one. That
Yeah.
month is it's
It's
gone,
gone. Yep.
gone.
Just do better.
Yeah.
Yep. And so I think a lot of the time what happens, especially with social media, people, everyone's documenting their journey. And I think what happens is people compare. So it's like, well, Tommy, who's 470 pounds, he lost 20 pounds in a month. But, Lucy, who's maybe only 200 pounds, she's stressing out because she's only lost 3 pounds. But that's the thing, you guys, like, not everybody's starting point is the same. So you can't be like, well, I want to lose 20 pounds a month because he did or she did. But the more you got to lose, the quicker you're going to lose it. The less you got to lose, the slower it will get, right? So always keep that in mind. And if say someone is stuck in a stall for a couple months, what do you suggest they do to get the weight moving again?
Yeah, if that happens, also remember, I forgot to mention that we have Cindy Rios, right?
Mm-hmm.
That practically her job is in the post-op. If you have questions like this, you can contact Cindy Rios.
Mm-hmm.
Cindy Rios, she has weight loss surgery on her, and she can give you some good instructions of what can you do
Mm.
uh, to like the 5-day test pouch, or she can help you out with the diet, or she can tell you to do some blood work,
Yeah.
help you out with the stall. So remember that we have Cindy Rios, that she's there for you.
Mm-hmm. That makes sense. Now I know you got patients to get to, so I'm going to just jump straight into a few questions from the Facebook page, if that's okay, Dr. Ortiz. Some patients want to know a couple little things from you. Okay, so Jonathan O'Connell, Jonathan O'Connell. He's always he's one of the, he's an all-star contributor in the page. He wants to know, Dr. Ortiz, are you going to be on the next cruise reunion we're doing next year?
You know that I was in the first cruise, right? first cruise was like years ago.
That was before me. I don't.
Before
Were
you,
you? Were you on the first cruise?
the first one, yeah, of course.
Ah, that was
But
years and years ago. What, 10 years ago, maybe?
okay, but my my Juliana, who is my wife, and back then she was my girlfriend. She went also to that cruise, right?
Uh-huh.
And she got motion
Motion.
sickness.
Oh, no.
Terrible,
But you know
terrible.
what, Dr. Ortiz, you've got some good anti-nausea pills that you could give her.
Right, exactly. But he I remember that when I went back to the room, she was spitting blood of
Oh,
all the dry heaving
motion. Yeah.
that she was doing, and she was just like spitting a little bit of blood because obviously she hurt
Or
here in
something.
the throat, and well, we were in middle of the ocean, so and she has like a bad recollection about
Yeah.
that.
She's traumatized now.
Probably, and maybe that is why we haven't gone before. But
Ah.
we have good drugs, and I will try to convince her.
Good. Come on, Juliana. We need you there. All right. Yeah, because there's some actual like motion sickness stuff that you can take, especially for cruises. And there's like a thing I think you can put behind your ear, or like a bracelet. There's all sorts of things. So maybe give it another go because it's a lot of fun. And Dr. Ortiz, everyone wants you on those cruises. You know, I think we've got almost 200 patients booked for this next cruise. Yeah. Yeah, 170 something right now. People are coming on this cruise. It's a big one.
Well, what cruise? Which one?
We're already organizing the next reunion. So it's in September next year
Oh,
for the
so you
EOC reunion,
in September
September 2026.
we're gonna have another cruise.
Another cruise.
You calculate that there's gonna be 160 patients or what?
So far, the room's already booked. These patients book the rooms. Michelle, is helping them with the booking stuff. But yeah, people have already got their rooms booked and paid for, and we've already got about 100, I want to say it's like 170 patients.
So it's gonna be obviously it's gonna be more than that, right?
Yeah, it's going to be more. Like I think
it's amazing. It's amazing that they book with a lot of time.
Well, yeah, because it's cruises are relatively, when it comes to like an all-inclusive thing, they're affordable, but still some people need to save up for it. So if you just kind of secure the room and you put your deposit down, and that way they've got, time to kind of like, maybe 1,000 if they've got a roommate or something. But yeah, we've got a lot of patients coming on this next cruise. Every reunion, it's getting bigger.
Sure.
Yeah.
If we have a lot of patients, I will go.
Really? Oh my gosh, you guys, you heard it. Keep booking. Email Michelle. But yeah, we're over one. I'm pretty sure it's 170 right now.
Wow, I'm gonna tell Michelle to book me ASAP.
Really? Okay.
No, I'm gonna have the room. What's the guy? It's not a pilot.
The what do you call a cruise ship captain? There we go. I'm like cruise ship director, captain. There we go, Captain Ortiz.
Hey, room. I'm gonna tell Michelle to
You're like, can you get me the penthouse on Carnival Cruise Line, Michelle?
I'm gonna tell her that ASAP.
Yeah, you can, especially if Juliana gets seasick. There are rooms that have the balconies, or like with more of a panoramic view. So if you kind of see out and on the horizon, or just if you're in a room and you can't see, maybe
I'm gonna tell the other guys if they want to go, Galval, or the other people. I'm gonna tell them that impressive 170 pages. So I'm gonna tell most of them, if let's see how many of them can go, right?
Yeah, we'd love to. It's we're cruising out of Florida. We're cruising out of Louisiana, New Orleans, like the port that's there. So the day before the ship takes off, we're doing an icebreaker event. So renting out like we can't say the location yet, but a space where all the patients come the day before and everyone meets each other, because this is what we did last cruise. Everyone meets each other, mingles, they have a drink, and people kind of get loose, and you make friends that way. And so that by the time the next day comes, we all board the cruise together. We're all friends. We all know each other. And then we do stuff. And so we're docking in 2 places. One, I think maybe Cozumel, I could be wrong, and another place we're docking. And then there's like an event, both stops that Michelle's organized for patients to come on, and we're having like private events both things. It's going to be amazing, Dr. Ortiz. Last cruise was really good, and I think almost every single patient from last cruise immediately booked like day one when we announced the next cruise, and now it's just kind of snowballed. A lot of people seeing it on social media, how much fun we had, and now everyone's kind of literally jumping on board the boat. So it's exciting.
Oh,
It's getting bigger
so
each year.
a lot of people.
Yeah.
I was not expecting that number.
Yeah, I don't think we were. And it happened when we announced the dates and opened the bookings. A lot of people were just like straight out the gate booking their room. So that's really exciting. So yeah, Jonathan was one of the patients, and he's already booked for this next year. And a lot of plastics patients are coming too. So it's like not just weight loss, it's weight loss, plastics, all of them. Their companions come. But yeah, John was the one who wants to know. And then there's some comments under that. Michelle said, I'm trying. And then another patient said, well, what do we got to do to bribe Dr. Ortiz? So people want you there, Dr. Ortiz. So
I was gonna tell them to just a drink. That drink is gonna be okay.
Okay, so
everybody gives me the drink.
If everyone just buys you a drink, you're there. Dr. Ortiz, on the cruise, you just get a whole package and you can drink as much as you want on the whole cruise. It comes in your package. You just buy the drink package.
I don't drink.
Well, I didn't think you did. But if you did, there's that option. You can just or you can drink pretty much. So yeah, I think you deserve it, Dr. Ortiz. You deserve a little time off and to be around all your successful patients. I think that'll be fun. Yeah. Okay.
Well,
so next question. Go ahead.
To do it a must, and I'll tell the other. I'll spread the word here, and we can go, right?
There you go, you guys. You heard it from the horse's mouth. If he gets more people on the cruise, he's coming. So if you want to get in on the cruise, and if you want Dr. Ortiz in on the cruise, make sure you email Michelle at eliasortiz.co. Tell her we want in on the cruise, and we're going to get Dr. Ortiz there. I think that is an accomplishment in itself. So thank you guys for joining in this episode of Bariatrics and Beyond with the man, the myth, the legend himself, Dr. Ortiz. And we'll catch you next week on Bariatrics and Beyond. Bye, guys.